Hey guys, Dr. Luke Stringer here from Advanced Health Chiropractic, and we're discussing low back pain, and it's a really effective way of treating low back pain. Unfortunately, it's a common area that gets missed with many other clinic providers. So when you're evaluating, or when we're evaluating low back pain in Advanced Health, we discuss or we evaluate the structure of your spine, the functionality of the joint, and the health of the soft tissue. So when you evaluate a healthy low back, you should have a nice even curve. Repetitive stresses such as sitting shift your spine out of alignment. It puts stress and tension into the soft tissue. We've discussed how weakness occurs from those compensatory patterns of having a weak pelvic floor and a weak pelvic posterior chain through inactivity, essentially that sedentary lifestyle of sitting. And what happens is the tissue has to compensate, and that compensation breaks it down. So exactly how does it break down? So when you evaluate healthy tissue under a microscope, should look really structured and uniformed. However, poor posture, repetitive stresses, compensatory patterns beats the tissue up and it starts to look like this. Well, the body's obviously not going to allow us to walk around with tissue that's all broken down, so it just heals. But when it does so with something called adhesion. We all know it as scar tissue. It's collagen within the muscle. This then forms the foundation that supports and moves your low back. This is weak, it's inflexible, it's going to create your low back pain. So this is an awesome way at Advanced Health that we can break down, particularly the fascial component, essentially the tissue that contains the muscle, how we can break that adhesion down in that fascia. By doing that, we can improve your mobility, get you out of pain and get you functioning without any pain. This is how we do it. So the best way to break down that adhesion is essentially pull the spine to flexion. So you're going to round it, it's going to bring some tension into the fascia, and then you can palpate, and then all we're going to do is make some passes over this fascia. Now you obviously can't hear it or feel it like I can, but I can feel it in Suzanne's fascia here. She's got lots of kind of little gristly bits. Essentially, that is adhesion. Adhesion again creates weakness, instability, and over time pain. And then you want to make sure we focus on the little ligaments between the spinous processes, those little bumps we feel down the middle of our back. So when you supplement that technique with mobility exercises, stabilizing, strengthening exercises, adjustments in traction, we call it the 360 degrees of wellness. You address the components of good posture within the spine, good joint function, good tissue health, and that's how we get really good results here, particularly with low back pain at Advanced Health Chiropractic. So if you're suffering with low back pain, hit the button at the bottom of the video. If you're suffering with low back pain, hit the button at the end of the video, fill out the contact form, and we look forward to seeing you at the office for a new patient consult.